Welcome friends, today we'll discuss about the other antiarrhythmic drugs. This includes atropine sulfate. Atropine is a muscarinic receptor antagonist that increases the sinus rate and SA and AV conduction. It is a treatment of choice for severe bradycardia or hypotension due to vagal overactivity. It is used for initial management of symptomatic bradyarrhythmias complicating inferior MI and in cardiac arrest due to asystole. The usual dose is 0.6 mg IV repeated if necessary to a maximum of 3 mg. Repeat dosing may be necessary because the drug disappears rapidly from the circulation after parenteral administration. Adenosine. This works by binding to A1 receptors in conducting tissue, producing a transient AB block lasting a few seconds. It is used to terminate SVTs when the AB node is part of the re-entry circuit or to help establish the diagnosis in difficult arrhythmias such as atrial flutter with 2:1 AB block or broad complex tachycardia. Adenosine is given as an intravenous bolus, initially 3 mg over 2 seconds. If there is no response after 1 to 2 minutes, 6 mg should be given. If necessary, after another 1 to 2 minutes, the maximum dose of 12 mg may be given. Patients should be warned to expect short-lived and sometimes distressing flushing, breathlessness, and chest pain. Adenosine can cause bronchospasm and should be avoided in patients with asthma. Its effects are greatly potentiated by dipyridamole and inhibited by theophylline and other xanthines. Now, digoxin. Digoxin is a glycoside purified from the European foxglove, Digitalis lanata, which slows conduction and prolongs the refractory period in the AB node. This effect helps to control the ventricular rate in atrial fibrillation and may interrupt SVTs involving the AB node. Digoxin also shortens refractory periods and enhances excitability and conduction in other parts of the heart, including accessory conduction pathways. It may therefore increase atrial and ventricular ectopic activity and can lead to more complex atrial and ventricular tachyarrhythmias. Digoxin is largely excreted by the kidneys, and the maintenance dose should be reduced in children, older people, and those with renal impairment. It is widely distributed and has a long tissue half-life, about 36 hours, so that effects may persist for several days. Measurement of plasma digoxin concentration helps identify digoxin toxicity or undertreatment. Now, this table shows response to intravenous adenosine, that is arrhythmia response. In supraventricular tachycardia, it terminates. Termination occurs atrial fibrillation, atrial flutter, and atrial tachycardia. Transient atrioventricular block. In ventricular tachycardia, there is no effect. Now, digoxin toxicity. Extracardiac manifestations as anorexia, nausea, vomiting, diarrhea, altered color vision, that is xanthopsia. For cardiac manifestations, it is bradycardia, multiple ventricular ectopics, ventricular bigeminy, that is alternate ventricular ectopics, atrial tachycardia with variable block, ventricular tachycardia, ventricular fibrillation. Thank you, friends. Now the other drugs are atropine, adenosine, and digoxin. Atropine, that indications is treatment of bradycardia and or hypotension due to vagal overactivity. Route of administration through IV. The dose is 0.6 to 3 mg, and the adverse effects which occurs is dry mouth, thirst, blurred vision, atrial and ventricular extrasystoles. Adenosine. The indication is treatment of SVT, aid to diagnosis in unidentified tachycardia. Is given through IV 3 mg over 2 seconds, followed if necessary by 6 mg, then 12 mg at intervals of 1 to 2 minutes. There may be flushing, dyspnea, chest pain. Avoid in asthma. Digoxin treatment and prevention of SVT. Rate control atrial fibrillation can be given through IV or oral. In IV, loading dose is 0.5 to 1 milligram total, 0.5 milligram over 30 minutes, then 0.25 to 0.5 milligram after 4 to 6 hours. And oral dose is 0.5 milligram repeated after 6 hours, then 0.065 to 0.25 milligram daily. The adverse effect is gastrointestinal disturbance, xanthopsia, arrhythmias. Thank you, friends.